Hey drivers, Dr. Nussi here again, and today I want to give you the most common reasons that unfortunately we have to fail drivers during their DOT physical. So I'm actually going to give you the top 5 reasons that unfortunately we see in our offices why we cannot certify a driver when they come in to take their DOT physical. But I also want to give you some tips or some hints that you may be able to implement with each of these circumstances to help maximize your chance that you will pass the DOT physical. All right, let's get right into it. Okay, so number 1, the most common reason that we have to fail a driver during the DOT physical, and this one is by far the most common, is blood pressure issues. So first things first, not to scare everybody out there, just because you have high blood pressure does not mean that you cannot be certified to drive, does not mean that you cannot pass the DOT physical, but the FMCSA, the Department of Transportation, does set very particular guidelines, and if you do not fall within these guidelines, your certification may be shortened or you may not be able to be certified at all. So a couple reasons why a driver would not be able to be certified. One is if they don't know that they have high blood pressure and we actually find out that they have high blood pressure and it's significantly high, then we will not be able to certify them until they're able to get their blood pressure down. Some of the more other common reasons is sometimes people will come in, drivers will come in and they'll be on high blood pressure medication, but they just won't be taking it correctly, or they won't be taking the right doses, they won't be taking it at the right time. So please make sure you are complying with taking your medication correctly the way that your doctor has prescribed so that you do fall within the limits. And then another real common issue that I have seen in our offices is sometimes drivers will come in and they've just drank a whole bunch of coffee or a whole bunch of caffeine of some sort, and caffeine's a stimulant. It can elevate your blood pressure temporarily, and then sometimes we read that as high, and if it's again too high, it might shorten up to a year potentially the length of your certification, or if it's too high, we may not be able to certify you at all. So please don't take excess stimulants, especially caffeine, before you come in to take your Department of Transportation physical unless it's for some reason medically necessary. All right, so the number 1 reason that we have to disqualify drivers that they cannot pass their DOT physical is blood pressure. Okay, so the number 2 reason why we have to fail drivers when they're taking their DOT physical is an issue that comes up during their urinalysis. So when you come in, we're going to do a complete history, we're going to do a physical exam, but then we're also going to take a urine sample. Now, this is not a drug test. We're looking for things like blood in your urine, and then more commonly, what we find the issue with is sugar in your urine, glucose in your urine, and that's a test for diabetes. So if there is sugar, glucose in your urine, it may delay or make it more difficult to certify. You may not be able to be certified. Now, there's really only a couple reasons, again, for this to be the case. Number 1 is you did not know you were diabetic, and we are actually the first one that's finding that out, and then we are going to have to send you to another doctor to get that under control before you will be able to be certified. But again, more commonly what we have seen is that people or patients just aren't taking their medication correctly, and it's just not controlling the problem. So please, again, just make sure that you are taking your medication exactly correctly, just as prescribed, so that it is controlling this issue and that nothing comes up during the urinalysis portion of the DOT physical. All right, that's number 2. All right, so before I get into number 3, I just want to remind everybody to please subscribe to this channel and then hit the bell icon next to the subscribe button, because every time the FMCSA, the Department of Transportation, makes any changes to their protocols, I'm going to make an update video because I want drivers to be informed on what we are looking for so you don't have any surprises. All right, so on to number 3. Number 3 is sleep apnea. So again, it's okay to have sleep apnea, but you want to be going through the proper treatment to manage it. So if you have documentation on using a CPAP machine or whatever treatment that you're going through, please bring that in, because if you mark sleep apnea on your history form and we ask you about it and you're not able to demonstrate that you're compliant with whatever treatment you're going through, it may make it more difficult for us to certify you during the Department of Transportation physical. Okay, number 4 is smoking. So smoking, again, the standards are set by the FMCSA, and they are very, very clear about this. If you're over the age of 35 years old and a current smoker, you have to have specialized lung function testing that most facilities do not do. You would have to be referred to another provider to do that testing. And based on that testing, you would either then be able to be certified or potentially not. So if you're a current smoker, I suggest that you quit smoking before you come in to take the Department of Transportation physical. And 4B would be smoking or using of any kind marijuana. Marijuana is still not allowed, even with a prescription, even when used for a valid medical reason. If you are using marijuana currently, even medical marijuana, that is a disqualifying factor. So make sure that you are not using marijuana and you're not a current smoker. Okay, last, certainly not least, number 5 on the list is having some sort of disability without having a special performance evaluation. All right, so this applies to someone, let's say, that is an amputee, that does not have full use of both of their hands and both of their legs. So the FMCSA, the Department of Transportation, again, wants to make sure that it's safe for you to operate a commercial vehicle. And to do so, if you have, some kind of disability or an amputation, you may be required to have a special performance evaluation by an expert or a specialist in that field before you are certified. Now, generally, when you come in to take the Department of Transportation physical, if we feel that it's necessary that you have one of these, then we will be able to set you up with the appropriate doctor. But again, that could delay your results, and potentially, depending on what that specialist says, may unfortunately cause you to fail the Department of Transportation physical. All right, I hope that was helpful, and I hope that makes it easier for you to go in and be prepared to take your DOT physical and gives you some of the stumbling blocks that we see drivers go through. All right, take care, everyone.